Today in this lecture, we will talk about the countercurrent exchange in vasa recta and how it preserves hyperosmolarity of the renal medulla. Previously, we have discussed that the osmolarity in the renal medulla is very high. Osmolarity in renal medulla is very high as compared to the cortex. This is this is sort of a loop of Henle, and this is the loop of Henle of a nephron, which is a juxtamedullary. So here we have the cortex of the kidney, and here we have the medulla, and we see that the concentration down the medulla in the medulla is high as compared to the cortex. And why this is high, how this is high, how it has been maintained, we have explained all those things in detail in our previous lectures. That concentration in medulla is high, or the medulla is hyperosmolar, which is a requirement for making concentrated urine. But once this hyperosmolar medulla has been achieved, how it is maintained. Now these are nephrons. This is a loop of Henle of a nephron, but the kidney needs blood supply as well. So the blood supply, especially to the medulla, is also in the form of U-shaped blood vessels known as vasa recta, and they preserve hyperosmolarity of the renal medulla. Now suppose this is a kidney. So this is a kidney, and we have some cortical nephrons and some juxtamedullary nephrons. Cortical and some juxtamedullary nephron. Now, if it has not been for the U-shaped these blood vessels, then it would be very difficult to maintain the hyperosmolarity of this medullary region. But due to this U-shaped region, it is very easy to preserve the hyperosmolarity of the renal medulla. How? When blood enters through this U-shaped vasa recta, come deep down with the juxtamedullary nephrons and then go up in this U-shape formed. And what happens is that when blood enters this U-shaped blood vessel, initially osmolarity of the plasma is low, and we know that the osmolarity of the medulla is high. As this vasa recta goes down, it descends, and the plasma also goes down. The blood in this vasa recta, this blood vessels goes down. It it enters into an area of higher and higher and higher and higher concentration. So higher concentration means there are a lot of solutes. So we know that solutes always move from a region of higher concentration towards a region of lower concentration. If the solute concentration is 600 here and 300 here, so solute starts moving out here. Solute starts moving into the here blood vessel, and we know this is a capillary and it is very porous. It will allow movement of all kinds of molecules except proteins. So solute starts entering here, and the concentration of plasma in this capillary, this vasa recta, starts increasing. Solute starts moving in and water starts moving out, because when the concentration of this area increases, to balance out the concentration of this region with this medullary region, the water moves out. This is also a principle. It moves with the help of diffusion. So when this plasma moves down, the concentration here is more, so more solutes enter and more water leaves. When it moves down, more solute enters here and more water leaves out. But we have to preserve the hyperosmolarity. Of the medulla. So the nature has provided the kidneys, the medulla, with this U-shaped blood vessel, U-shaped capillaries instead of straightforward capillaries. So now the blood starts moving up from the medulla. It is now moving upward. As soon as it starts moving upward, now the concentration here is high. Because of more movement of solute and diffusion out of the water. Now what happens is that solutes here are low. Concentration here is high and here is low. Solutes concentration in the blood vessel is high as compared to outside the blood vessel. So solute starts moving out. And when it goes upward, more and more solute starts going out, because the concentration is high here and it's low here. And as a principle, we know that solutes like sodium, ions like sodium, potassium, urea, they will leave from region of high concentration towards the region of lower concentration. So they move out. And now what happens is the concentration of water here is high, so water starts entering again here. So there is no net change in the osmolarity of the medulla. There is no net change at the end. Whatever osmolarity of the plasma was here has been achieved again here, and this way it preserves the hyperosmolarity of the renal medulla. And this is basically achieved with the help of U-shaped form of the vasa recta. But it is important to notice that solutes are going in and out. So there is supply of oxygen and supply of all the nutrients that are required for the nourishment of molecules in the medulla, so they are being supplied here. The waste material may enter and the fresh ions required may enter into the medulla. So there is exchange going on. Oxygen, the nutrients, they all will be supplied, but at the same time, a lot of solutes are going out as well. So there is supply of the blood vessels, there is supply of nutrients, there is supply of blood to the medulla, and at the same time, the concentration in the medulla is preserved. Now, what happens? If the blood flow, if the arterial pressure here increases, if the arterial pressure here increases and more, the blood starts moving rapidly in this vasa recta, or if there is some intake of vasodilators, and these blood vessels dilate, and there is movement of large amount of fluid here, there is a possibility that the hyperosmolarity of the medulla may be washed out, may be washed out. So it may be washed out with the help of high arterial pressure in these blood vessels or with the intake of vasodilators. So although the U-shape of the blood vessels, the U-shape of capillaries, the vasa recta helps in the preservation of hyperosmolarity of the renal medulla, but if it is washed out with the help of a high arterial pressure or intake of vasodilators, then the kidneys will not be able to make concentrated urine. It will not be able to make concentrated urine, or it will not be able to concentrate more despite of increased amount of antidiuretic hormone available. It will not be able to concentrate urine. So that's why it is very important to preserve the hyperosmolarity of the renal medulla, and that is something which we have discussed so many times. Thanks a lot for watching the video.